So I think I'm a really good listener, and I'm really interested in people's stories and what makes them tick. So I think in general practice, we don't always have enough time to listen to the backstory, but we're fortunate that we get to see people on multiple occasions. And I think a person's social and cultural background have a huge influence on their state of health, and it'll definitely affect how much they're able and willing to take on board. So yeah, just having a listen and not trying to put people into boxes. I think that's one of my superpowers. That's a really good question. And I would say it's battling the beast of uncertainty. So as you know, the scope in general practice is so broad. You have to keep up to date with the latest evidence and guidelines, and you have to have excellent problem solving skills. And sometimes the answer is just not immediately evident. And I think it takes courage to admit this to yourself and to your patients. All the more important then to involve them in sort of the thinking process, explaining what's going on, explaining that you might have to phone a friend or ask a colleague, and then staying connected if they are referred. So staying in communication with the specialist and the patient, and just coming to terms with the fact that it's impossible to know everything, and also that it's okay to look things up. There's excellent resources at our fingertips today. It should be okay to say to your patient, look, just wait a minute, I'm going to look that up, or am I going to look at the latest evidence and get back to you? And I think your patient and yourself shouldn't perceive that as a weakness. Yes, certainly. So I think new motherhood is one of those battles that I see a lot. Having a new baby is tough, and asking for help and struggling does not mean you're a failure. Sort of tying on with that is breastfeeding. It might be natural, but no one tells you it's not easy. So I've seen tears in mothers' eyes, just having honest conversations and getting some validation and getting help where it's needed. And I think a third big area is mental health, sort of reducing the stigma around it, talking about it, seeing the role of medication when it's necessary. There's lots of good stories that I've witnessed without going into too much personal details. I do. And I actually don't want to open too much of a can of worms here, but I would have to say it's the anti-vaccination movement. And while I absolutely believe people should be able to make decisions for themselves and their loved ones, there's just so much misinformation out there about vaccines. For example, have you heard about the fact that it contains all sorts of dangerous chemicals? So it's like aluminium that's used in some vaccines to enhance the body's response to the vaccine, but you would actually get less from that than you would get from your diet or from medication like antacids. And I think misinformation creates fear and doubt, and it costs lives, and I often come across it in my line of work.